Those of you who don't know me, my name is Garner DeSales Morgan. People who love me call me Butch. I named my sons Luke and Adam. Guess why? It's much easier. Okay? All right? Full disclosure, I am an investor in this company. All right? Okay? I was a Rotarian many years. I love the Rotary. I'm a Paul Harris Fellow. Okay? I made a family decision to work on another project that I speak to you about from time to time, my Mission of Mercy, the big dental clinics we put on throughout the state. One's coming up in College Park. We'll have one in this area next year here. Okay? I understand people have to leave at 8:30 because I too used to be there. At 8:30 they'd be this great speaker and I'd want to stay, but I had to get up and I had to see a patient. Okay? Change. Okay? I've been practicing in dentistry. It's a good thing because in medicine we can practice. You guys got to do a real job. You got to do it right. We can keep practicing. Okay? For 40 years. I don't do anything the way I learned 40 years ago. Nothing. I love working with my son. He came to work for me, and he said, Dad, I want you to show me a few things. And I put my arm around his shoulder, and I said, no, son, we're going to do things your way. And so I think that's helped the relationship. Okay. I have one, what we're talking about, medical marijuana today. Okay. Charlie came to me a few years ago and wanted me to get involved, and I said, no, I'm not interested. Nope. He said, look into it. I said, okay. So he came back 3 weeks later, and I said, nope, Charlie, I'm not interested. He said, look at this and whatever. Okay? And I'm an investor in this as long as we're in medical marijuana. When it gets to be recreational, I probably will be out of it. Okay? I believe in the medicine part of it, and I believe it's true medicine. I believe it's a different thing, going in a different direction, and I think it will help a lot of people. Okay? I have a close friend of mine. His wife was dying of cancer 3 years ago, and that's part of why I'm with this group today. And she was on all sorts of different drugs. Okay, he went to Pennsylvania and bought and purchased some marijuana. I told him he could have gone to Waldorf or Lexington Park. Okay, and she led a normal life the last 3 months of her life as far as pain control was under control. She was well controlled. Okay, so there are opportunities for this. But this drug today, we learned, will not all be smoked different ways. There are many. I'll let the experts talk about it. So that brought that to my attention, and it's a new industry, and it's evolving. So, Megan, you want to come up and give us a talk?
Thank you for having us. My name is Megan Shank, and I'm here thanks to Southern Maryland Relief. They invited me. I work for Holistic Industries. We're one of the companies that received a license to grow the medical cannabis in Maryland. We have a 70,000 square foot operation in PG County, and so we are going to be selling our products all over the state of Maryland. And but I've worked in this industry for almost 3 years. I moved to Illinois when they started a medical marijuana program a few years ago, and prior to that I worked in the pharmaceutical industry. So I saw so many people suffering, not just from chronic pain, but from addiction to prescription drugs, especially opioids. And 4 out of 5 people who overdosed from heroin actually started with prescription pain pills. So when I started to learn about how marijuana can actually help people get off of these opioids, I was fascinated. And so Maryland now has a program, and the program is run by the Maryland Medical Cannabis Commission, and it is not a prescription. It is simply a recommendation that someone needs to get from their physician, from their dentist, from their nurse practitioner, from their nurse midwife, from their podiatrist. And it's basically giving them the option to go and purchase medical marijuana at a dispensary. Southern Maryland Relief is the local dispensary in this area. And so what a lot of people don't realize is that cannabis has been used as medicine for thousands of years. It was actually part of the U.S. pharmacopoeia up until 1932. So patients were getting this as prescriptions from their physicians. And then there was a lot of political issues, a lot of negativity around this. Some people think it was for racial reasons, some people think it was for financial reasons, but regardless, it was demonized. You've probably heard of reefer madness, and then the laws changed. But keep that in mind that it used to be sold as tinctures, little containers, and I read an interesting article that said back in the 1920s when doctors were in medical school, they were warned when they made a tincture because they had to use alcohol as a solvent, and alcohol was illegal. So it's interesting how things have changed. Back then, cannabis was legal. But physicians now, I don't know if any of you saw this CNN special with Dr. Sanjay Gupta, but all these children are using cannabis, mainly CBD oil, to help with seizures. and they go from having 50 seizures a day to none. And these parents are moving their families out to Colorado so they can have safe legal access to this. But when people see these stories and read about it, their minds start to change. And so since 2013, more and more states have passed medical cannabis laws. I think there's 29 states now in the U.S., and Maryland is one of them. So in Maryland, keep in mind it is not a prescription. So if anyone wants to talk to their physician about this or have a loved one who needs to talk to their physician, keep that in mind, that it is not a prescription, it's simply a recommendation. And doctors are protected. Since they're not prescribing it and it's a Schedule I drug, they're protected by their First Amendment rights. They have the right to recommend this. And no physicians have ever been prosecuted for this. I met a doctor out of California who's been doing this since 1999. He's helped thousands and thousands of patients, mostly with cancer. And the side effects are very minimal compared to a lot of legal prescription drugs. So a lot of people are concerned they don't want to smoke this, and that's fine. We have many other options, and I'll get to those soon. But basically, the doctor doesn't control what the patient purchases. The patient will go to the dispensary, and the dispensary is going to hire people and train them properly, and they're going to be the experts. Similar to how a pharmacist can answer your questions, these dispensary techs will be able to help you. So in terms of risks versus benefits, you hear marijuana, you think, oh no, it's a legal drug. But if you actually want to look at the stats, you can go on the DEA website. No one has ever died from a marijuana overdose. You can die from drinking too much water. You can die from taking too much aspirin. But it's physically impossible. I was told that you would have to smoke 1,500 pounds in 15 minutes. It's just not possible. So the safety profile is very strong. But even more important than that, you can see in this JAMA article that there's actually been a interesting correlation between states with legal medical marijuana programs and lower rates of opiate-induced fatalities. So less people overdosing from heroin and Oxycontin and fentanyl in states with legal medical marijuana. So that's huge. And when I bring this up to physicians, they start to open their minds and they really see that this could be a great option for a lot of patients. And this is just more about how that happens. So there's a lot of different educational resources that I share with physicians and dentists and also with patients. There's ways to get CME certifications. I'm working with the Maryland Medical Society right now. They're going to be offering a CME program in September. So if you know any physicians who want to learn more about this, there are resources. But these are some of the top questions we hear from patients, and I try to shorten this presentation because I know we don't have much time. But the main thing is, how do I get certified? Well, you need to have one of these physicians, nurse practitioners, dentists do, but it's a one visit. You need to have a bona fide relationship. You need them to review your medical records. And then you just go onto this MMCC website and you fill out the forms. And we can talk to you about that after if you have specific questions. And I know Southern Maryland Relief will be having different sign-up events to assist patients with that. Obviously, you don't have to smoke it. We're going to be selling it in all different forms. Capsules, topical lotions, vaporizers, so it does not need to be smoked. Some people say, is this really powerful? Is it different than what people consumed in the 60s? It's different. I mean, we're growing now with very powerful lights. One of the benefits of buying it from a legal store is that you know that the grower has gone through rigorous application processes. Lab testing is critical. There are no pesticides. Every batch is tested, so you know exactly what the potency is. And so you know exactly what you're getting, and you don't necessarily get high. There's many products that do not contain THC, which is delta-9 tetrahydrocannabinol. That's the psychoactive compound in cannabis, but cannabis has over 100 different compounds that have medical benefits. CBD, cannabidiol, is one of them, and that's what they're giving to children with epilepsy. So like I said, the THC gets you high, but it's also been proven to help with nausea, vomiting, and stimulating appetite. That's why it's so helpful for people suffering from cancer and undergoing chemotherapy. But it can have some adverse side effects, right? Some people get paranoid, they get anxiety, they get disoriented. Whereas CBD has other therapeutic effects. It's actually an anti-anxiety, it's an anti-inflammatory. I gave some to my grandmother. She rubbed it on her knee for her arthritis, and she felt a lot better. So this does not get you high. So many patients prefer this. They can use it during the day, they can go to work, they can drive their car. And so you'll have many different options at the dispensary, but these are just some of the main similarities and differences between THC and CBD. You can even purchase products that have a 1-to-1 ratio, so they're more balanced. you don't get extremely high, but you do get some of those pain relieving benefits of the THC combined with the CBD. And I could get into this in depth, talk about the chemical reactions and everything, but I know we don't have time for that. But if doctors want to learn more, I'm happy to do that. So these are just some of the main palliative and therapeutic benefits. Appetite stimulation, it helps with nausea, seizure reduction, mood enhancement, migraine relief, sleep aid, anti-inflammatory, neuropathic pain relief, libido elevation, and antioxidant. So as you can see, this helps with such a huge variety of conditions. And if you could use one product that would replace, your Ambien, your Xanax, your Oxycontin, I think that's a great thing. It's not only better on your body, but it saves you a lot of money. So I've seen a few presentations on this by herbalists and by physicians, and it's important to keep in mind that this is an herb. This is not a synthetic drug that Pfizer sells. So this has so many different compounds, and they work synergistically. So it can take more time for it to build up in your body and to start working. Some people feel the benefits right away, but it could take 30 days. But unlike a prescription drug, it also doesn't have as powerful of an effect. You don't have that risk of addiction like you do with other drugs. The addiction rate with this is about 9%. Coffee is about 9%. It's a similar issue where people don't really have strong withdrawal symptoms with this like you do with opioids or alcohol. So it does have a very strong safety profile. So back to my company, Holistic Industries. So we're still in the construction process. We had to build this from the ground up because we're in PG County and the zoning regulations are so strict. But it's 70,000 square feet. It's incredibly high quality. We spared no expense on everything. So it's going to be great. I'm excited to give people tours. It's going to be very high quality medicine. Our processing director, our chief director of science, is a PhD chemist. His thesis was on extraction from hops and looking at terpenes from hops. He had his own dark chocolate company, so he's really excited about this, about making medicine with cannabis. And I'd love to introduce him to our patients once we're selling products. So this is our Liberty brand. So patients can purchase the dried flower. They do have the option to smoke. Most people will probably prefer to put it in a vaporizer where it will heat up and you'll just inhale vapor so it doesn't harm your lungs. These cartridges also are like an e-cigarette. I'm sure you've seen those. So they don't really have a strong smell and they're more discreet and they're easy to use. Tinctures are great. They're liquid. So you can just drop it under your tongue and go about your day. And then there's also topicals. So lotion, salves, balms, and those obviously don't have a psychoactive effect, right? Because they're not getting into your bloodstream. And different creams. And so, depending on how you consume it, sometimes it takes effect faster. Obviously, inhalation, you can feel the effects right away. Whereas if you were to have a capsule, it could take a few hours to take effect. Maryland does not allow edibles like chocolates and brownies right now. Eventually they might, but I think that's okay. If you look at Colorado as an example of when you hear negative stories, usually it's when someone ate too many chocolates and they ended up in the hospital because they were paranoid. So we're not going to have to worry about that here. But any specific questions about our products or our growing strategy or anything like that? Charlie, you want to? Sure. Oh yeah, last thing. There was a New England Journal of Medicine case study looking at a woman named Marilyn with breast cancer, and there were experts who presented opposing viewpoints, some in favor of cannabis, some against it, saying, there's little scientific basis. And then they polled 1,446 physicians, and 76% of those physicians were in favor of medical marijuana. And I think that's what you'll find in this area. If you talk to physicians and you really say, if someone is suffering from cancer, do you think they should have this as an option to improve their quality of life? Most people are going to be compassionate and open to this. So it just takes education and, learning the facts. So, thank you.
Good morning, everyone.
Good morning.
My name is Charles Mattingly. If anybody has any quick questions, since we're running out of time, I'd be more than happy to answer anything. I'm a lifelong resident of St. Mary's County. I'm one of the owners of Southern Maryland Relief. If anybody has any quick questions real fast, I'd be more than happy to answer. Sure.
Could you talk about the difference between the